Release our folk. Help us to understand our significance and history in the development of the world. Help us make America, America. Be with us as we continue the struggle in Stockton, California. Keep our mothers, our sisters, and our brothers inspired. So when injustice comes, there'll be somebody who will stand, and keep on speaking truth to power. This is our prayer. This is your servant's prayer. Amen.
This is your girl, Miss D, and I happen to be the president of Stockton Black Family Day of 2020. And what a year to be president, right? Kobe, COVID, Chadwick, like this is too much. Too many things have happened this year. And I should have probably invested in saved this year, right? But in any case, we have been resilient. We have been resilient despite all the things that have been happening. Our people have continued on. Black Family Day has continued on. And I'm so proud of the team here that has pushed forward to make sure that we continue the tradition of Stockton Black Family Day that was founded in 1968. During this 3-day event, you're going to hear about the history of Stockton Black Family Day. You're going to hear about some history of Stockton, Black Stockton, and also some of the organizations and resources that are here and available in the city. And the most important thing is our theme, celebrating our men. You're going to get to hear from the hearts of men, from the minds of men. And I have been overjoyed just to get to know some of these men. So thank you so much, all of you, for opening up and being transparent and just sharing a little bit of yourself with not only me, but with your community. I also thank you for all that you have done in the community, for your hard work, for your covering, for your strength, and most importantly, for your joy. You are our joy. Seeing you talk, seeing you in action, seeing you move, seeing you work, and seeing you maneuver on the behalf of the community is our joy. And one of the questions I asked you men were, what did you want us to know? What do you want to say to us? And I want you to know that I received all that you said. And I know that the community will receive it. And we pray that the rest of this year and just moving on forward, that we all got to know you a little bit more and we adjusted ourselves to the things that you need, the things that you need to hear, just the things that we need to do to support you more. So I think that's probably the biggest thing that I learned and that I gained is learning how to support you, hearing you, not talking, but just hearing you. And so I thank you for that. I thank you, Black men. I thank you, supporters. I thank you, community organizations. I thank you, just everybody that helped this year. And I pray that this is just the start, that we continue to build and continue to unite and be a help of one another. Make sure you tune into StocktonBlackFamilyDay.com or BFDTV.online every single day. And if you just happen to miss something, you can find it on YouTube or our website. Make sure you like, subscribe, watch, and most importantly, support. Celebrate your men 2020.
Hi, Stockton Black Family Day. This is Fayette Latrice coming to you with the power of one word. I hope you stay tuned because I'm going to share my story and how I have been inspired by words that I posted for 100 days. I attended a Wealth Empowerment Summit, was totally inspired by Lisa Nichols. The conference was probably over at 5 or 6 p.m. I didn't leave until after 8 p.m. and they were still there because she's so passionate about what she does. And when she sows into people, I've heard she'll have you up all night. But unfortunately, I had to leave because I had to support somebody's party, because I DJ on the side. So I had to go support their party, and I was disappointed, but you know what? The inspiration and that feeling that I got was still there. So Sunday morning, I'm home, I'm still relishing in what I received on Saturday, and I'm like, oh my God, I felt like I could just, fly. I have inspirations to write a book, or I had inspirations to write a book. And I literally all day Sunday was just like, please don't let this feeling leave. Please don't let this feeling leave. And then Monday morning I wake up and guess what? Reality hit. My 9 to 5, I had to go to work. So I go to work Monday. I'm getting ready to go to work Monday morning, and I'm feeling kind of down. I'm feeling like once I walk into my job, that everything I felt on Saturday is going to leave me. How am I going to keep that? So I had this idea to do daily affirmations, but to make myself, to hold myself accountable, I said, I'm not just going to write a daily affirmation on a Post-it and put it on the mirror. I'm going to put my daily affirmations on Instagram, Facebook, social media, and that's my accountability partner because I'll do #30. So I said, I'm going to do 30 days of daily inspiration, affirmations, just to wake up and keep myself motivated on a daily basis. I did that for 30 days. It was so liberating. I had a party. I literally invited family and friends to celebrate 30 days of my consistency, because that's real talk, the most consistent thing that I have done, at least like that, right? So 30 days celebration, and I'm like, what's next? And I thought about it and I thought about it, and I said, you know what? How about 30 days of happy, 30 days of joy? I'll encourage other people to post what makes you happy. Put a picture of it on Facebook or Instagram, whether it's what you're eating, who you're with in that moment, just post a picture. Let's just think about what makes us happy, what brings us joy. But I never got to that. Instead, I was led to do one word, to post one word. We say a lot with a lot of words like I'm doing right now, but one word is so powerful and so meaningful that I decided I'm gonna post one word for 30 days. And not only am I gonna post the word, I'm gonna give the dictionary definition, because that helps, and then I'm gonna talk about how that word shows up in my life. So I did that for 30 days, but I was feeling it and I was like, what am I gonna do next? And I felt led to continue to do 30 days. So guess what? I did it for 100 days. I posted 100 words for 100 days without fail. And at the end, of course, I celebrated, because I celebrate all wins. I'm big on celebrations. So I'd like to share some of the words that I posted. I like to talk about people. I like to talk to people about their word. What is your one word? Some people will automatically say, oh, I know what my word is. My word is purpose, or my word is faith. You know, my word is bold or courage, because there's a lot of words that really speak to who we are, or that speak to where we want to go or where we want to be. So people would ask me, well, what's your one word, Fayette? Well, my very first day of the 100 words, my word was inspiration, because this was all birthed out of inspiration. I was inspired, so that was my first word. So I'm gonna read the post that I posted on that day. And I started by saying, I'm feeling inspired. The power of one word. Remember, this was my first day of daily, of the one word. That sense of excitement you feel when your heart and your purpose are in alignment and you want to push past any obstacles or boundaries. This is how I felt after being in the midst of supportive family and friends. I'm so inspired by others. How does inspiration show up in your life? So I want to challenge you to think about what inspires you, what moves you. For some, it may be their children. It may be that work that they do, that project that they do. Some people are inspired by being in the presence of others. So think about what inspires you. Inspiration is a powerful word. And like I said in my message, It's when your heart and your purpose are in alignment. And I'm all about purpose. But I know in order to tap into your purpose, that you also have to be inspired to do so. So let inspiration be your word for the day. And think about what inspires you. Have a great day, Stockton Black Family Day.
Burris here, and I'm going to be sharing with you a two-part teaching. You are watching part 1 now, and then you'll receive part 2 later. And what I'm going to be sharing with you over these next 2 parts is 12 attributes of a power couple. Now, whether you are single or married, this will help you, and I think it'll speak to you. Those of you who are single, this will help you as you move forward into your future relationships. Those of you who are married, I think this will either confirm or tighten up some areas of your marriage that may perhaps be a little more weak than other areas. All right. So I want to share with you 12 attributes of a power couple. You may want to write these down, grab something to write with. I will share with you 6 in this teaching, and then I will come back with part 2 and we'll share the last 6. All right. You guys ready to write? Let's go. Let me give you these 12 attributes of a power couple. Attribute number 1, you feel like your best self in the relationship. You feel like your best self. You're confident. You feel safe. You feel secure. So one of the attributes of a power couple is both parties feel like their best self in the relationship. In other words, I don't need you to affirm me. I don't need you to prop me. Let me take that back. I love when you affirm me. What I don't need you to do is prop me up. All right. So I love affirmation, but in a power couple relationship, I'm confident enough in myself. You're confident enough in yourself for us to do life together as a unit and as a power couple. So number 1, you feel like your best self in the relationship. All right. Number 2, and I hope you're writing these down. Again, I think you can apply these both now and later. Number 2, you slay your goals. You slay your goals. The second attribute of a power couple is you slay your goals. Research shows couples in strong relationships are more creative and more productive. And so one of the ways I can identify that I'm in a power couple relationship is I feel confident in myself. It helps me feel confident. But number 2, I slay my goals. I'm more creative. I'm more ambitious. I'm more driven when I am in a relationship that is that of a power couple. All right. So it really moves you. It motivates you to slay your goals. Number 3, I want you to write this down. You focus on the things you love about your partner. You focus on the things you love about your partner. On the flip side, you don't waste time fixated on that which irritates you or bothers you the most. All right. You don't waste time on that. You don't waste time being fixated on that which irritates you or bothers you the most. So if we're talking about what a power couple looks like, they are people who are very confident in who they are. They are, number 2, people who are very goal-based, goal-driven. They are really given to pursuing and conquering goals. Number 3, they are focused on what they love about their partner. They aren't focused on how negative their partner is. Now, that doesn't mean we don't dismiss it, all right? We don't discount those things that bother us because we have to communicate those, but we aren't fixated on it, all right? So we don't fixate on those things. Number 4, I want you to write this down. A power couple, they prioritize each other daily. A power couple prioritizes each other daily. They make each other a priority. Now, this is important. This is key because most power couples are busy doing other things. They're building, they're developing, they're growing businesses and ministries and partnerships and networks. And they're putting all of these things in place for their future, for their legacy. But at the same time, they are very mindful and very intentional about prioritizing one another. All right. So number 1, they feel better. They feel like their best self in the relationship. Number 2, they slay their goals. Number 3, they focus on things that they love about their partner. as opposed to things that they despise or don't like about their partner. Number 4, they prioritize each other daily. All right, that's number 4. Now, again, I'm giving you 12 attributes of a power couple. Right now, I'm going to give you 6, and then I will come back later and give you 6. We're on number 5 right now, which means we're almost done. Number 5, you feel grateful for your partner. Power couples build relationships on the foundation of gratitude. So I feel when you're in a power couple relationship, I'm grateful for you. You're grateful for me. All right. We're grateful for one another. We're grateful for what each other brings to the table. All right. So we're not so stuck on just what I can receive, but we're also given to, listen, I just want to be grateful. I have gratitude for one another, for what you bring to the table. All right. So power couples show gratitude toward one another. They are mindful to say thank you. They're mindful to say, I appreciate you. All right. They're mindful to say, I value who you are. So there's an immense measure of gratitude among power couples. If you are going to be in a power relationship, you must be able to show and express some form of gratitude. You must be able to express how grateful, how thankful, how happy you are to be doing life with the person you're doing life with. All right. That was number 5. Number 6, I want you to write this down, and this is the last one we'll share in this segment. Then we'll come back for a part 2 and share the latter 6. Number 6, you support each other in your individual pursuits. So when you are in a power couple situation, relationship, you support each other in your individual pursuits. In other words, I'm not jealous of you because you are pursuing a goal. I'm not jealous of you because you are trying to better your life. I support you. I support what you're building. I support your vision. I support it. If you say you want to go back to school, I'm going to rally behind you because I support you. That is what a power couple does for one another. So you must be supportive of one another's vision. That means I have to lay my ego aside. I have to lay my frustrations, even with my own life, aside, and focus my attention on making sure that I get behind you and support you. All right. So I'm giving you 12 attributes of a power couple. I just unpacked 6. I'm going to give you those 6 again, and then we'll come back for part 2. Number 1, write it down if you haven't already. You feel like your best self in the relationship. You feel like your best self in the relationship. That's number 1. Number 2, you slay your goals. A power couple, they slay their goals, individual and as a corporate. Number 3, you focus on things that you love about your partner, as opposed to focusing on things that you don't like or that you despise or that you loathe. Number 4, you prioritize each other daily. That's going to be important, especially because you're busy. You guys are building and establishing, and so you must prioritize each other daily. Number 5, a power couple feels grateful for their partner. They're grateful for their partner. They're excited to be doing life with this person. And number 6, you support each other in your own individual pursuits. In other words, I don't have to make you small so that I can feel big, but I'm going to get behind you. I'm going to rally behind you. I'm going to push you to your purpose. I'm going to support you in every way that I can, because a win for you is a win for us, and a win for me is a win for us. And so I support you. I rally behind you, and I just push you. I make sure that you have everything you need to fulfill your purpose. All right, so we're talking 12 attributes of a power couple. That was the first 6. We're going to come back later with the last 6. And I really hope these are helping you and blessing you. All right. Again, you can follow us at #BFDTV, and we hope to see you soon. And I want you to take a moment to just kind of rehearse what you just discussed, look at the notes, and make sure that it sits well with you. All right. Chat with you soon.
Stockton Black Family Day. My name is Toussaint Haki Stewart, and it gives me a great pleasure to be invited to the 52nd annual Stockton Black Family Day. I, being a professional health and wellness practitioner, I feel so great. I feel so humbled to be able to share my gift with you guys of wellness. We're going to be doing a BYOB class, which is bring your own body weight strength training, where all you need is your own body to get this done. And then we're going to follow up with a recovery shake, a plant-based smoothie, so we can focus on how to use plants to fortify our bodies as well after the workout. In this time of COVID, I really encourage everybody to make exercise and plant-based diet a lifestyle. These are the two lifestyle choices that can prevent lifestyle disease and chronic pre-existing conditions that are ravaging us and giving us vulnerabilities to COVID-19. So we want to be able to address our own health care before we have to go to a doctor. And I just so thankful and humbled to be brought to Stockton. I represent Town Wellness. Our moniker is food, fitness, and freedom. And I serve Stockton as a practitioner with the city of the Parks and Recs of Stockton, California. And I'm also a PE teacher as well with a plant-based focus. So I encourage you guys to work out with me, participate with me, and make this a lifestyle. Welcome to my BYOB class. This is bring your own body weight. Okay, we are going to be doing a strength training workout today, right? Okay, now we focus on 5 components when we're doing BYOB. Okay, the first component is cardiovascular training. The second component is dynamic stretching. Okay, then we want to get into our strength training. Then we're going to go to core training. And then after that, we're going to do our cool down static stretches for recovery. All right, so now I want you guys to join me in our first component, which is cardiorespiratory fitness. And we're gonna do a 2-minute cardio, right? You can do this with a jump rope, or you can do this with dumbbells, or you can just do it with your hands free, okay? I'm gonna be doing box jumps for 10 seconds, and then I'll be doing 10 jumping jacks, and I'm gonna alternate, all right? This is gonna get our full body warmed up. Let's go, all right? Ready? And begin. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Jumping jacks. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, good. 7, 6, 5, 4, 3, 2, 1, and 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. 10, 9, 8, 7. Good job. 6, 5, 4, 3, 2, 1, and 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and 10. Hang in there. 5, 8, 7, 6, 5, 4, 3, 2, 1, and 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 10, 9. Good. 8, 7, 6, 5, 4, 3, 2, 1, and 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and 10, 9, 8, 7, 6, 5, 4, 3, 2, and stop. Good job. All right, we got our cardio in. We should have maximum oxygen going to every parts of our body and maximum blood flow, which prevents injury. Now we go into our dynamic stretches. Let's go ahead and rotate your neck. All right, good. Make sure we're breathing in through our nose, out through our mouths. Good. Excellent. You should have a little sweat. Okay. Good. Dynamic stretches are stretching on the move. Okay. Using your breath. Now we'll go ahead and rotate our wrist because we will be doing upper body work today as well. Okay. Good. Excellent. Now we're going to go ahead and work our shoulders. Okay. Good. Arm swings, horizontal arm swings. Good. Go ahead and just hug yourself like that when you come back to the front. Keep breathing in through your nose, out through your mouth. And we're going to go ahead and do vertical arm swings, front to back. Good. You know our shoulders are 360-degree joints. Make sure we get those warmed up all the way. Good. Okay. Now we'll go ahead and do dynamic high knees, right? Get our groin stretched out and our quadriceps as well, and our hip flexors. Okay. Very important. Okay. We're just stretching on the move. Dynamic stretches. Okay. This is going to help prevent injury and keep the blood flow going. Okay. So we can prevent injury. All right. Now we want to go ahead and get into our first body part, which is our legs, right? You build a house from the bottom up. We're going to start out with crane lunges. So come down here on one knee. Okay. Then we're going to start our crane lunges. Come up and we come up here. Bam. So it's a dynamic lunge and it's great for your stability. We're doing 20 each leg. 4. Good. 5. 6. Good form. 7. 8. 9. 10. 10 more. Come on. 10. 9. 8, 7, 6, 5, 4, 3, almost there, 2, and 1. Let's switch. I'll come to this side so you guys can see what it looks like from here. And go. 1, 2, on our left leg now. 3, 4, 5, 6, 7, 8, 9, 10. Good. 10. Come on. 9, 8, 7, 6, 5, 4. Hold on. 3, 2, and 1. Good burn. Now, we got those out the way. Now we're gonna go ahead and do some drop squats. This is another dynamic exercise. Great for your stability. In through your nose, out through your mouth. Start out with drop squats, feet together, and we're gonna drop. 1, together, 2, together, 3, together, 4, 5, good, 6, 7, 8, 9, 10, 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Good work. A little bit of recovery here. Good. You should be really feeling it right now in your quads, somewhat in your hamstrings as well. Now, we're gonna drop to the floor and we're gonna continue with our legs, but we're focusing on our hamstrings now. Very important. So we'll come down on the mat and we're gonna do core kickbacks. Here we go. Come down here and we'll start out with our left leg. We bring our knee to our core and we kick up. 1, 2, 3, 4. Magic number is 20. 5, 6, 7, 8, 9, 10, 11, 12. Good. 13, 14, 15, 16, 17, 18, 19, 20. Good job. Switch to our right and come up to our core and kick back. 1, 2, good. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, last one, 20. Good work. Okay, we got our lower body done, our foundation. Now we're gonna go to our shoulders and our back. First exercise we're gonna do is we're gonna do body crawl to shoulder slap. This is a combo exercise. So we're gonna be here. Our feet will be shoulder width apart, right? Bend your legs a little bit like this, bend your knees a little bit. And then we're gonna crawl out. 1, 2, 3, 4. 1, 2, 3, 4. We're gonna do 10 of those. All right, ready? And let's work them shoulders. Come on. 1, 2, 3, 4. 1, 2, 3, 4. 1, 1, 2, 3, 4. 1, 2, 3, 4. Good. You're also working your core when you do this. 1, 2, 3, 4. 1, 2, 3, 4. That's 3. Good. Keep breathing through your nose. And 1, 2, 3, 4. 1, 2, 3, 4. Good. Keep going. 1, 2, 3, 4. 1, 2, 3, 4. That's 5. Halfway there. Let's go. And 1, 2, 3, 4. 1, 2, 3, 4. Good. Excellent. 6. 1, 2, 3, 4. 1, 2, 3, 4. Excellent job. 7. Good. 1, 2, 3, 4. 1, 2, 3, 4. Good. Here we go. 8. 1, 2, 3, 4. 1, 2, 3, 4. All right. Let's get to 9. Come on. 1, 2, 3, 4. 1, 2, 3, 4. Excellent. Last one. Let's go. 1, 2, 3, 4. 1, 2, 3, 4. And back up. Excellent job. All right. Let's see what else we have for our shoulders and our back. Now we're gonna go ahead and come on the mat. And what we're gonna do now is we're gonna do snow angels to Superman. This is another combo exercise. So, snow angels are here, right? Like this. But when you do a Superman, you come up here. Notice my thighs are off the ground. We're not doing this, but we're here so we can develop strength in our lower back to prevent injury. All right, here we go. Combination. So, snow angel, Superman, 1, snow angel, Superman, 2, snow angel, Superman, 3, snow angel, Superman, 4, snow angel, Superman, 5, snow angel, good, Superman, 6, snow angel, Superman, 7, snow angel, Superman, 8, snow angel, Superman, 9, snow angel, Superman, 10, excellent. 20 reps total. Like I said, 20 is the magic number. All right, good work. Now, we're gonna go ahead and do our chest and our obliques. All right, first exercise we got going. This is gonna be another combo exercise, right? When you work on your full body, we do combo exercises. So here we go. All right, so we're gonna do wide grip push-ups with a wide grip full body plank. So I'll do 20 push-ups. You can even do them on your knees if you need to, but we're gonna be here and go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now our plank hold for 30 seconds. Good. We don't have our butts up here. We don't want them to be way down here. We want your waist to be about where your shoulders are, and stay focused. Prevent injury that way as well. Good. Excellent. Excellent. Hold on. 10, 9, 8, 7, 6, 5, 4, 3, 2, release. All right. We got those done. Now we're gonna do our obliques. We just did our chest. Now we do our obliques. Staying on the theme of a plank, we're gonna do a side plank, which will be working our obliques, okay? We're gonna do both sides. So, we're gonna do 30-second side plank, and then we'll do 10 hip ups. So, the hip ups are like this. We're gonna stagger our feet, right? We start our plank here, and after 30 seconds, we'll start our hip ups like that. That's gonna isolate your oblique, okay? And up. Good. Use this time to breathe nice and deep. Good. We're at 10 seconds. Let's get 20 more seconds. Good. 10, 9, 8, 7, 6, 5, 4, 3, 2. Now go. 1, 2, good. 3, 4, 5, 6, 7, 8, 9, and 10. Good job. All right, now we're gonna switch over. Good work. I know these are not easy. They're not supposed to be. All right, obliques are very important for your lateral movement and your stability. Ready, set, up, 30 seconds. Nice and tight. Good. Use this time to catch up to your breathing. Breathe through your nose, out your nose, or breathe through your nose and out your mouth. Good, 20 more seconds. Ten, 9, 8, 7, 6, 5, 4, 3, 2, hip ups. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good work. Obliques and chest done. Now we're gonna go to the component of core work, okay? We're gonna do 2 core exercises. First one, leg drops. So we're gonna turn this way so you can see me. I'm putting my hands by my lower back and above my butt, right at the top of my butt to protect my lower back. Legs go up, and we're gonna do 20 leg drops. Down, 1, down, 2. This is great for your lower core. Down, 3, 4, good. 5, keep breathing through your nose. 6, 7, 8, 9, 10, halfway there. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Good job. How we doing out there, y'all? Y'all with me? Come on, Black family. Let's go. All right. Last core exercise, we got bicycles. We come down here, elbow to knee. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Excellent. Now we made it to stretches. All right, static stretch cool down. You always want to start out with your cobra pose to help straighten out your lower back, okay? Very important, okay? So here we go. Come down here, slight push-up position on the floor, but we're only lifting our upper body. Breathe in and breathe out. Breathe into it about 5 times. Good. Then we come out on all fours and we come down to our child's pose. To stretch our shoulders and our upper back. Breathe into it about 5 times and go deeper. Okay, then we come up here and we're gonna go ahead and stretch our groin by doing the frog stretch. Breathe in about 5 times. Excellent. Then we come up here and then we just go ahead and touch our toes. You can get down to your palms on the floor, that's great. To stretch our hamstrings out. Excellent. Great workout. And now I will be meeting you guys over at the smoothie bar for our recovery shake. right? Because after every workout, we need to recover. Let's go. Welcome to my smoothie bar. After our workout, we want to focus on recovery. The best way to recover is with a plant-based smoothie. Now, this smoothie can be made throughout the day, not just after your workout as well, right? First thing we want to start out with though is water, right? We want the smoothie to be smooth. So we got our good filtered water in there, okay? And the most important element of our smoothie are the greens. This is 2 cups of spinach here, okay? Spinach has a lot of anti-inflammatory properties, but also has liquid sunshine, chlorophyll in it, right? Which is great for your blood and great for anti-inflammatory purposes in your body, which you really need after a workout. Then we have some of our favorite fruits. We got some apples, wedged apples, and we also have a banana. Okay, bananas have potassium, which is extremely important for your muscle recovery as well, right? Helps prevent muscle cramps, okay? And we also have an avocado, which has your healthy fats, right? And avocados are very anti-inflammatory, okay? And great for your heart, okay? So we're just gonna get all of that good avocado in there, okay? All right. Now you can use whatever your favorite fruits and vegetables are. We also have ginger, which is extremely anti-inflammatory, great for your bones, great for your joints, and great for your blood sugar, right? This balances out your blood sugar as well as all of these ingredients do, okay? And last but not least, we have cinnamon. We're gonna just put a half a teaspoon of cinnamon. Cinnamon has about 25 to 30 different trace minerals in it. And cinnamon is also anti-inflammatory and antimicrobial as well. Great for your digestive system, right? So this smoothie is gonna help us with our gut bacteria, but also help us recover from the workout, right? So you wanna make sure you have a smoothie ready to go after your workout, or just have a smoothie ready to go throughout the day, right? I like to make a lot so that way I have smoothies to go to throughout the day. So I keep myself fortified with plants, okay? Now we're gonna go ahead and blend it up and drink it up. Here we go. Okay. We got that nice green color coming from the spinach. You can smell the banana. Good. Right, excellent. We are ready. See what this looks like. How green can you get, Stockton? Probably not greener than me, but we'll see. Cheers. Enjoy. And may the plants be with you. Thank you for joining me at my smoothie bar. May you have a great recovery.
Hi, my name is Mel Parker, and I'm a urologist with Kaiser Permanente in the Central Valley. I've been practicing for the past 25 years, and I've chosen a few topics that I think are important when it comes to men's health. I really wanted to focus on things that really make a difference. We'll be covering information about COVID-19, which is, as you know, the new threat. We'll talk about prostate cancer screening, who should be screened and when. And we'll also talk a bit about erectile dysfunction. A lot of men wonder, is it just me who's having this problem? COVID-19 is something that has impacted the lives of every one of us. It certainly is a new threat, is something that all of us are concerned about. And as we know, the Black and Latinx communities have been significantly impacted. We know that the virus is spreading throughout our community, and this is for a variety of reasons, in part due to discrimination, which leads to inequity in social status. We know that we have healthcare inequities, lack of access, as well as difficulties with occupations where we're not able to work from home. We also have challenges of housing where things may be more crowded. All of this leads to an increase in the rate of COVID-19. We also know that the messages that we have received have been confusing and have been inconsistent, and that really poses a challenge. San Joaquin County, as I said, has been significantly impacted. As of August 16th, we've had over 15,000 cases with 261 deaths. So you start to think, what can I do? First and most important, wear a mask. The mask protects you and it protects others. We also encourage you to wash your hands frequently with soap and water or with hand sanitizer. You want to avoid touching your eyes, nose, and mouth when your hands are unwashed. Please stay home if you're sick, even if you just think that it's a cold. Some of the symptoms of COVID-19, like cough and fever, can be similar to those of a cold. Maintain 6-foot distancing and avoid crowds. And then if you feel ill, call your doctor, get tested, and stay isolated until your test results return. You really want to make sure that you're not transmitting a disease to other people while you're waiting for results. I really want to focus on social distancing, which is so important. You want to avoid large crowds. It's been many months now since we've been isolating for COVID-19, and we know that many people are longing to be with family and friends. It really is important that you avoid crowds, even when it comes to family members. And if you're elderly or have underlying illnesses, please stay close to home, wear your mask, and only go out when necessary. So our next topic will be the prostate. Now, the prostate is quite a mystical organ. Many people hear the word, but really aren't quite sure where it is or what it does. So I would like to demystify the prostate. So the prostate is located directly below the bladder. Urine flows from the bladder through the prostate and out through the urethra. It actually is an organ the size of a walnut, and it's similar to a donut in that there's a hole in the middle that the urine flows through. Now, the function of the prostate is to produce fluid for semen during sexual activity. Most men really don't think much about their prostate when they're young and healthy. But as they grow older, sometimes men will develop symptoms of an enlarged prostate. These would be symptoms such as a decrease in the flow of urine, having to urinate frequently or urgently, having to wake up several times at night to go to the toilet to urinate, or in severe cases, not being able to urinate at all. And you can see from the diagram that with the normal prostate, urine is able to flow through the prostate, through the urethra. When the prostate is enlarged, the tube is more narrow and it's more difficult to get the urine through. There are many treatments for an enlarged prostate. In general, if a man is having mild symptoms, often they won't need treatment at all. Otherwise, there is medication that can be used, medication that helps to relax the muscles between the bladder and the urethra. There also is medication that can shrink the prostate. And then if symptoms are very severe, there are surgical procedures that can help to open up the channel and allow the urine to flow more freely. Prostate cancer is another disease of the prostate. Prostate cancer is the second most common cancer diagnosed in men, second only to skin cancer. In 2020, it's estimated that there will be 191,000 men diagnosed with prostate cancer in the United States, with over 30,000 men who will die of the disease. Prostate cancer is more common in African American men, and it also tends to run in families, meaning that if your father, your grandfather, or your brother has had the disease, you are more likely to get it. How do you detect prostate cancer? Well, early prostate cancer has no symptoms at all, and that's one of the difficulties. Occasionally, a man will have a rectal examination and an abnormality will be found, and that's a way of diagnosing cancer. But in the vast majority of men, prostate cancer is diagnosed because they have an abnormal PSA blood test, or prostate-specific antigen. Once a man is suspected of having prostate cancer, a prostate biopsy can be performed under local anesthesia in the office. So what is PSA, prostate-specific antigen? PSA is a protein that's produced by the prostate that's able to be detected in the blood. A higher amount of PSA tends to be detected in the blood when prostate cancer is present. Normal values generally are from 0 to 4, but a man who's younger, say in his 50s, will have a lower PSA, while a man who's older will have a higher PSA. Now, a high PSA does not always indicate prostate cancer. In the same way, a normal PSA doesn't always mean that you don't have cancer. So when we think about prostate cancer screening, looking for prostate cancer in a man who has no symptoms at all, we always want to talk about the risks and the benefits of screening. So what are the benefits? If you undergo prostate cancer screening, the cancer may be detected early at a time when it can be cured. Hopefully that would lead to a reduction in the likelihood of death due to prostate cancer, and also would make it less likely that you develop symptoms due to prostate cancer, since advanced cancer can cause bone pain and also can require treatment, such as treatments that take away the testosterone. So what are the risks of prostate cancer screening? Anxiety would be one. If you have a blood test for PSA and find that the PSA is elevated, you may become anxious, and it may turn out that you don't have prostate cancer at all. If you're found to have a high PSA, a prostate biopsy may be recommended, and there are risks of pain, bleeding, and infection. If cancer is detected, treatment may be recommended, and there are side effects of treatment from prostate cancer: possible leakage of urine, possible problems with erections, or problems with bowel function. Now, what did the experts say? The American Urological Association in 2018 recommends that men between the ages of 55 and 69 should discuss prostate cancer screening with their physician and should consider a PSA blood test. Now, that age of 55 is for men who are not at higher risk of prostate cancer. They also recommend that prostate cancer screening be done every 2 years. We used to recommend the test yearly. Now it's every 2 years if you have a normal PSA blood test. In addition, prostate cancer screening is not recommended for men who are over the age of 70, and it's not recommended for men who are expected to live less than 10 to 15 years. So my recommendations for prostate cancer screening: between the ages of 45 and 70, African American men should discuss prostate cancer screening with their doctor. Keep in mind, Black men need to be screened earlier because prostate cancer is more common and they tend to be diagnosed at a higher stage with more advanced disease. You also want to make sure that when you have that discussion with your doctor, that you talk about the possible risks and the possible benefits of prostate cancer screening. You also have the opportunity to read up on it. There's lots of information about prostate cancer screening. You want to be well informed when you have that discussion. You need to have a doctor who you can trust, someone who you can talk to and communicate with. And keep in mind, don't be afraid to bring up the question of prostate cancer screening, even if your doctor doesn't mention it during the visit. So really, beginning at age 45, make sure that you're having that discussion with your doctor. And then our final topic is erectile dysfunction. What is erectile dysfunction? It's the inability to attain or maintain an erection that's sufficient for sexual performance. It tends to increase with age. You may not know that over 50% of men who are over the age of 40 have some difficulty having erections. A lot of times we think that only older men have this problem, but half of men over the age of 40 will have some difficulty. So what causes erectile dysfunction? There are lots of causes: diabetes, liver failure, kidney failure, alcoholism, sometimes surgery related to the prostate or rectum can cause the problem. You can have a problem as a result of an injury. And then medications, some pretty common medications like medications used for high blood pressure, some antidepressants or sedatives can cause problems with erection. Very often, we don't know why the man is having the problem with an erection. It's something that tends to occur with age. The evaluation tends to be fairly simple. Your doctor will talk to you, get information, talk about the symptoms that you're having, and will also perform a thorough physical examination. So what can you do when it comes to preventing erectile dysfunction? Number one, avoid smoking. Smoking has a significant effect on blood vessels, including blood vessels that go to the penis, and so it's a common cause of problems with erection, so you want to avoid smoking. Healthy eating is important. You want to realize that sexual activity is a physical activity, and so you want to be in your best shape. Exercising regularly, again, helps to keep you in your best shape, and you'd like to avoid excessive use of alcohol. So what are the treatments related to erectile dysfunction? There are a number, and we're going to talk about oral medication, a vacuum erection device, intracavernosal injections, and penile prosthesis. Medication is by far the most common. The medications are called phosphodiesterase inhibitors, and all of us have heard of them. Viagra, Levitra, Revatio are all medications that can help to increase the blood flow to the penis and help with erectile dysfunction. A couple things to keep in mind. The medication should be taken on an empty stomach, and it should be taken at least 1 hour prior to intercourse, and you want to proceed with foreplay as normal. There are several medications that these medicines cannot be taken with. Certain heart medications like nitrates can cause life-threatening reactions. And common side effects of the medicine are headache, vision abnormalities, flushing, or nasal congestion. And usually these are mild. Most men are able to tolerate those symptoms pretty well. A vacuum erection device is another treatment. It's a cup device that's placed over the penis that sucks blood into the penis. Then typically a band is placed at the bottom of the penis to hold the blood in. There are no significant side effects. It does take away spontaneity, but it works very well and is very safe and effective for use. Penile injections are another way of increasing blood flow to the penis. The injection is given shortly before intercourse. There can be some side effects. Some men will develop penile pain or bleeding. You also can develop an erection that doesn't resolve, doesn't go away for a long time. It can also cause some scarring of the penis. We generally recommend that a man begin with a low dose and increase the dose as needed. And what generally we're looking for is for a man to develop a normal erection within about 10 or 15 minutes of the injection that lasts for about 1 hour. And then finally, when other treatments fail, there is the option of what's called a penile prosthesis. These are rods that are surgically implanted in the penis with a pump that goes in the scrotum. And when a man wants to have an erection, they're able to squeeze the pump, and that leads to the erection. So what I'd like to say is, problems with erection are common. Intimacy is so important that it really is worth having a conversation with your doctor and having treatment if you're having difficulty having erections. I'd like to thank you for listening, and I hope that you enjoy Black Family Day. Thank you.
Hello, my name is Junar Wallace, Community Liaison for Donor Network West. I'm here today to share a very important message to you about organ, eye, and tissue donation. A lot of times when we go to our local DMVs and we're asked, would you be an organ, eye, or tissue donor? Some people say yes and some people say no. But 97% of our signups comes through our local DMVs. Currently, we have over 111,000 people on the national waiting list in need of a life-saving organ. In San Joaquin County, we have over 400 people, and in Stanislaus County, we have over 300 plus people that are in need for organ donation. So in the state of California, we have over 22,000 people that need organs in our state. We're the one state that needs organs more than any other state in the United States. And a lot of that comes from diabetes, kidney failures, heart disease. So I'm here today to ask you the question, have you considered to be an organ, eye, and tissue donor? And if not, I ask for you to visit our website at www.donornetworkwest.org. But the most important thing, the call to action today is share your decision with your family. It is one of the best decisions that you can make in your life. Once again, thank you so much for receiving this message today. Have a great day.
Hello, my name is Manny Alfonso. I'm a registered nurse, a clinical nurse specialist out of St. Joseph Medical Center, a Common Spirits Health partner. And on behalf of St. Joseph Medical Center and the Healings in Motion, it gives me pleasure to present to you and tell you some simple recognition of stroke symptoms. The letter BFAST, B-E-F-A-S-T. B stands for balance. Part of the brain that controls our balance is the posterior part, to be exact, is the cerebellum. When there's a clot that lodges in that part of the brain, we will lose our balance. The next letter is E. It stands for eye. The occipital part of the brain, which is also the back end of the brain, controls our vision. It takes a tiny clot because the eye itself doesn't take much blood perfusion for us to be able to see. So if we actually have a clot that lodges into that very tiny capillaries of either eye, we will cause some eye pain, we will feel some blindness, and maybe some blurred vision. The next letter is actually the letter F. F stands for facial droop, face on either side. If a clot lodges on the right side of the brain, we will feel the weakness on the first half or on the left side. So left facial droop is actually one of those symptoms. Our tongue will be hanging out and we won't be able to actually speak correctly. The next letter is A. A stands for arm weakness. Like I said, if a clot lodges on one side of the brain, the other side actually suffers. Again, if the clot lodges on the right side, we will have perhaps weakness or paralysis on the left arm. The next letter is the letter S. S stands for speech. Speech is controlled by the temporal and the parietal lobe of the brain of each hemisphere. The temporal lobe and the parietal lobe allows us to be able to pronounce and enunciate each and every word of the alphabet, and we are also to construct words that we are about to say. So if there's clots lodged on either one of those areas, we will have slurred speech. The last letter is T. T perhaps is the most important letter of this particular mnemonic. T stands for time. Do not waste time. Call 911 so the EMS, our paramedics, can bring you to the nearest hospital, the nearest emergency room, so you can receive the appropriate care. And if it's indeed a stroke, we have a window opportunity of 3 to 4.5 hours. If a clot lodges in there and you meet the qualification, we will administer the clot buster as long as you show up on time. Please do not delay.
Hi, this is Mary Nicholson, the founding director for Healings in Motion. I want to share some of the upcoming events for Healings in Motion. One is the Brain Health to Beat Stroke 5K. You can come out and run, walk, or roll. Find out more if you go to healingsinmotion.org. The other things that we're doing are support for caregivers and also survivors. Thank you so much.
Hi, I'm Stephanie.
And I'm Peter.
And we're with JIC, Drug Awareness Committee. Our mission is to educate children, teens, and adults about prescription drug abuse, poison control, and opioid medications.
In this video, we will be educating you on the dangers of opioid overdose and the proper use of Narcan. We hope you enjoy this presentation. Before we can help someone experiencing an accidental opioid overdose, here are some key differences between side effects, sedation, and an overdose. A person experiencing an opioid overdose will have difficulty breathing, will not respond to any shouting or shaking, and will have very small pupils. If you suspect that a loved one is having an opioid overdose, you may be able to reverse this by using Narcan nasal spray, an opioid reversal agent. First, identify if the person is experiencing an opioid overdose by checking if they respond to stimulation. You can shout their name, shake their shoulders, or firmly rub the middle of their chest with your knuckles. Also, check for other signs of an opioid overdose as previously mentioned, such as difficulty breathing or small pinpointed pupils. Once an overdose is identified, lay the person on their back to receive a dose of Narcan nasal spray. To administer Narcan nasal spray, hold the device with your thumb on the bottom of the plunger and your pointer and middle fingers on either side of the nozzle. Gently insert the tip of the nozzle into either nostril. Tilt the person's head back and provide support under their neck with your hand. Press the red plunger firmly to give the dose of Narcan nasal spray and remove the device from their nostril afterwards.
Finally, get emergency medical help right away by calling 911. Move the person on their side into recovery position so that their hand supports their head and their knee keeps their body from rolling onto their stomach. If the person does not respond by waking up or breathing normally within 2 minutes, an additional dose should be given in the other nostril. If you or a loved one are taking opioid medications, you can request Narcan from your healthcare provider or by accessing the electronic application provided by the California Department of Healthcare Services. Lastly, here are some tips to prevent an accidental opioid overdose. Avoid taking opioids with alcohol, a class of drugs known as benzodiazepines, or other medications that can make you sleepy. Talk with your doctor or pharmacist if you miss or change doses, feel sick, or start new medications. Thanks for watching. If you have any further questions, reach out to your healthcare provider or local pharmacist.
Hello everyone, the Mental Health Awareness Committee would like to thank you for watching this short presentation on anxiety, depression, and memory loss. Throughout this presentation, we will provide some background knowledge on these conditions and ways to help manage them. The purpose of the Mental Health Awareness Committee is to educate the community about mental and neurological disorders in an effort to reduce the stigma that is often associated with these conditions. If you have any questions or concerns regarding this presentation or would like to be directed to more resources, please do not hesitate to call, text, or email MHAC using the contact information listed on the screen. Thank you for your time, and we hope you enjoy this presentation.
Coping with anxiety and depression can be challenging, but the Mental Health Awareness Committee is here to help you manage your mental health. Some tips on helping yourself include becoming an expert, so learning more about the medication treatment options, learning about more what you can do in terms of helping yourself. That includes the medications and the non-pharmacological therapy, including exercise and things of that sort, knowing your triggers and stressors, partnering with your healthcare providers, getting healthy, avoiding drugs and alcohol, and finding support. Despite the fact that there are 4 different types of anxiety disorders, all anxiety disorders have one thing in common: that's persistent excessive fear or worry in situations that are not threatening. And individuals may experience one or more of the following. So they may experience emotional symptoms, which include feelings of apprehension or dread, feeling tense and jumpy, restlessness or irritability, anticipating the worst and being watchful for signs of danger. They also include physical symptoms such as pounding or racing of the heart, shortness of breath, upset stomach, sweating, tremors, twitches, headaches, fatigue, insomnia, and frequent urination. Both genetics and stress contribute to the development of anxiety. Some families will have higher than average numbers of members experiencing anxieties, and studies do support that. The evidence that anxiety disorders run in families. Stressful, traumatic events such as abuse, death of a loved one, violence of prolonged illness are all often linked to the development of anxiety disorders. Despite the fact that there are varying anxiety disorders, each anxiety disorder has a different set of symptoms and the treatments can vary, but There are three main categories that the treatments fall under. The first is psychotherapy, including cognitive behavioral therapy, medications, including anti-anxiety medications, and complementary health approaches, including stress and relaxation techniques. It's imperative that if you're concerned that you may be experiencing anxiety, to be sure to contact your primary care provider. Depression affects various age groups as well as varying racial, ethnic, and socioeconomic groups. Common symptoms include changes in sleep, appetite, lack of concentration, loss of energy, lack of interest, low self-esteem, hopelessness, and physical aches and pains. Potential causes of depression include trauma, including childhood trauma as well as genetics, life circumstances such as money problems, where a person lives, and marital status, brain structure, other medical conditions such as ADHD, history of sleep troubles, long-lasting pain, anxiety, and things of that sort, as well as drug and alcohol abuse. The treatment options for depression, in a sense, coincide with those of anxiety, such as the medications and the psychotherapy, but they also include exercise, alternative therapies, and mind-body-spirit approaches. It's important that if you're concerned that you may be experiencing depression, to contact your primary care provider.
In terms of memory decline, everyone is forgetful at times, and this can result in missing keys or even a misplaced phone. Oftentimes, forgetfulness comes with age due to changes in the brain. This can also lead to slower learning. These changes are considered minor forgetfulness and can be quite normal. However, serious memory problems may indicate underlying changes which should be addressed. There are many possible reasons for memory decline. Aging is one of the possible causes. The brain ages just like any other part of the body, and changes in the brain may result in memory decline. Another potential cause is dementia and Alzheimer's. Dementia is characterized by memory disorders, personality changes, and impaired reasoning to the point that it interferes with daily life. It can be caused by conditions such as Alzheimer's. Side effects of medications can also be a cause. Some medications can cause memory impairment. Consult with your doctor to see if this applies to any medications you are taking. Diseases that affect the brain may also lead to changes in memory. Treatment of these diseases may help reduce its effect on memory. Anxiety, stress, and depression are all conditions that make a person more forgetful. Other reasons and causes might be head injury, stroke, and sleep deprivation. Did you know that good nutrition and exercise is important for maintaining proper brain function? Deficiency in vitamin B1 and B12 may impair memory. Developing interests or hobbies and staying involved with community activities can also help both the mind and the body to stay healthy. Studies have shown that heavy drinking can also lead to memory loss and brain damage. While there is no standard treatment for memory loss, treatments may include counseling, medication, or both. People who are concerned about memory problems should see their doctor. The doctor will most likely conduct a physical and mental health evaluation. A correct diagnosis will lead to proper treatment.
Hello, I'm Dr. Keenan Davis, the prosthodontist here at the Dental Studio of Hampton Roads and PermaSmile Dental Implant Center. I'm honored and pleased to have been asked to speak briefly about the overall importance of good oral health. So good oral hygiene or dental hygiene is essential in helping us prevent tooth decay, bad breath, gum disease, and thereby allowing us to maintain our teeth as we get older. And a healthy mouth can help fight off different medical disorders. So our oral health is definitely connected to our overall health. So you might ask, what does the health of my mouth have to do with my overall health? Well, your mouth is actually a window into what's going on with the rest of your body, often giving early signs and symptoms of systemic diseases that pertain to your entire body, such as diabetes or AIDS. Your studies show that 90% of all systemic diseases show oral signs and symptoms. So with that being said, there's certain things that can be done, such as testing the saliva, which is much like testing the blood when you go to a physician's office, that can measure things like environmental toxins, hormones, antibodies, illegal drugs. Saliva also is one of the body's main defenses against bacteria and viruses, in that it contains antibodies that can fight those pathogens. So a healthy mouth goes a long way in protecting the body. The opposite, however, is true as well. So an unhealthy mouth with plaque and bacteria can cause gingivitis, which is a mild form of gum disease, periodontitis, or even trench mouth. And bacteria from the mouth can enter into the bloodstream during routine brushing or flossing if gum disease is present due to bleeding gums. And then this bacteria can then stick to the walls of the heart, causing what's called an endocarditis. Or if you happen to have any prosthetic joints, it could adhere to those joints. So research has shown for years that there's a direct correlation between the bacteria found in the plaque of an unhealthy mouth and the plaque found in heart disease. Also, if you have dental problems such as cavities or gum disease, it can impair your ability to eat and speak properly, cause pain. If you can't chew properly, you can't digest your food properly. GI problems, stomach and intestinal problems can be the result of that. If you're not passing your food properly, then you can develop polyps in your intestines. Those polyps can progress to something as serious as cancer. So there's a plethora of things that can happen by not properly digesting your food because of poor oral hygiene. So practicing good dental hygiene is so important because it can prevent these types of diseases and systemic problems as well. So good oral or dental health translate to good overall health.
I'm Chef Tobias Cooks, and today I am making seafood and vegan mac and cheese. The San Francisco Bay Area. All right, welcome back, Cooks Time. This is our vegan mac and cheese. Okay. Vegan gluten-free mac and cheese. The story is my oldest daughter, when she was about 7 years old, was diagnosed with celiac disease. We had no idea what that was. No one ever heard of gluten before, especially growing up in Louisiana. What is gluten? Anyway, so that led me on a 13-year journey on how to make vegan gluten-free foods, because she decided at 13 to go vegan as well, okay? So anyway, this is just a rendition of the vegan mac and cheese that I had to make before vegan or celiac disease was popular, okay? So shout out to all my vegan people and all my gluten-free people that have a hard time trying to feed yourself. So hopefully this recipe, it's very easy to do and it's great for you. And let's just get started right now. Okay, so the first thing I did is I tried out many vegan cheese, but you have to remember, this was about 13, 15 years ago. There was no such thing of vegan cheese. So I kind of had to make my own, but over the years, I've seen different people do different ways of making vegan cheese, adding different things to it. So probably about 5-7 years ago, I came up with my own technique. It looks like a lot, but trust me, at the end, it is very yummy. Okay, first thing you saw me cut up the potatoes and onions and celery with a little bit of garlic and pink salt. So what I'm gonna go ahead and do is put that in the food processor. I don't want to add a lot of liquid to it because, you know, you still want that melty texture of cheese. You don't want it to be liquidy or runny like it's soup or something like that. So the potato is going to give it that nice smooth texture. The carrot is going to give it the color of cheese, yellow. And then the celery and garlic and salt, of course, is going to add that nice brightness of cheese flavor. Okay, so here we go, a little bit here. There we go, that looks wonderful. I'm gonna add red onion. When I first started doing it, I did not add the red onion, but this is something I kind of added on to it. It gives it that little punchy kind of acidity cheese flavor. All right, so for chickpeas, almost forgot the chickpeas. The chickpeas are very important in vegan cooking. You will see a lot of use of chickpeas in vegan cooking. Okay, so the chickpeas, of course, for texture as well. This is the seasoning blend that I'm going to use. It's paprika, lemon pepper, cumin, salt, black pepper. All right, and we're gonna go ahead and put this in here. If you want to make it a little bit spicy, you can add some cayenne pepper to it. That also gives it a nice spice as well. All right, and the most important thing to any vegan cheese, whatever the ingredients you decide to make, is the nutritional yeast. You need the nutritional yeast. Okay, so let's put that in on top there. And bear with me, here we are. And then we want a little bit of the liquid, of course, as we go along. So, okay, so let's go ahead and give it a little bit of pulse. Let's get a little bit of the liquid out. Always reserve your liquid because it has the starch in it from the chickpeas and from the potato. Okay, let's pulse it. Let's see how it looks first. All right, look at that. Coming along. To what you would like it. Coming along good. All right, put it on. All right. Ooh, smells so good. Smells delicious. Okay, so now we have the vegan cheese that's already nice and done. It's nice and creamy. Look at that. It has the wonderful flavor and color that I was telling you about. See how the carrot gave it a nice flavor. The chickpea and the potato gave it this nice creaminess, and then the nutritional yeast is what's going to give it that cheesy cheese flavor that you're looking for. Okay, so I have my gluten-free panna pasta here. You could pretty much find any gluten-free pasta in your local store. It's relatively inexpensive now. You could do it in the rice, garbanzo bean, red lentil. They pretty much have a lot of variety now. More variety they had when 13, 15 years ago when I was trying to make this for my daughter who had celiac disease. Okay, so if you notice, I'm not using any nuts just in case someone has a nut allergy. Sometimes the nuts did kind of bother her a little bit, so I had to learn how to make it nut free as well. Okay, so this is easy right here. I'm trying to tell you, it's really, really easy. Anyone will be able to enjoy this. Okay, so the next thing I'm going to do is olive oil, a little bit in your Pyrex, just a little bit, just like that. Here, come with a little clean paper towel, and we just want to, the pan, just like this, a little Pyrex. Wonderful. How cool is that? Okay, once I do that, we have the penne pasta. They probably have gluten-free elbow pasta, but I know that she used to like the penne pasta as well. Okay, so here we are. Look how creamy that came out. Oh my goodness. That came out super, super, super creamy. Smells so good too. I mean, it really, really smells good. All right. So a little bit, and then let's go ahead and, oh, look at this. It smells delicious. Okay, so I am going to add a little bit of soy milk. You can use rice milk. If you want to use nuts, if you can use nuts, you can. I would recommend the cashew milk. The cashew milk is very creamy. Oh, I love using the cashew milk. But for this one here, we are going to use the soy milk. Rice milk is a little bit light. The soy milk and the cashew milk, I found, tend to give it a little bit more creaminess that you're looking for. Look at that. See? This is going to be great. Okay, I have the pink salt. I didn't have the pink salt 13, 15 years ago. That's okay. I'm a little fancy now. I'm a little older now. I could do the pink salt. So a little bit of the pink salt. And then let's go ahead and get the black pepper. Need the black pepper. Have to have the black pepper. If you don't want to use the black pepper, you can use white pepper. And let's give it another stir. And this smells so good. And I'm proud of myself. I'm really proud of myself for the past 13, 15 years of developing gluten-free vegan foods for my oldest daughter. All right, and you can tell she's grown now. Like she's grown. But I still make it. I still make the meals. Okay, so here we go. So I did go out and purchase some vegan cheese. I'm going to put this in the comments, but I found that this vegan cheese is actually one of my favorites here. Okay, so let's go ahead and layer it up. So before I do that, I have some panko breadcrumbs. This is the gluten-free breadcrumbs mixed with Italian seasoning. So look for the gluten-free breadcrumbs, and you can get the basic one and then just add the little Italian seasoning to it. Or if they already have the gluten-free breadcrumbs with Italian seasoning, then you can do that one as well. Okay, so let's go ahead and get my spoon so we could get a lot more in here. Look how creamy that is. Look at the texture. It's wonderful. And then I am going to take the vegan cheese that I purchased and put that on top just like this. Isn't that wonderful? Look at there. All right. Now, growing up in Louisiana, I've never heard of anything like this before. Vegan, don't know what that is. Gluten-free, never heard of it. But as you get older, and now I live in California, you're gonna hear about vegan and gluten-free. All right, let's go ahead and get another layer on there. Am I using up all the cheese? Yes, because if you don't know about cheese, it's always good to keep layering the cheese. All right, look how good this is. Okay, one more layer. I think we could squeeze one more layer on top of here. This smells so good. I can't wait for this. This is going to be divine. All right, look at here. Look how good that is. Ugh. Okay, let's see. You know what? I'm gonna just put the rest on it just like this. Here we go. How wonderful that is. Okay, there we are. Beautiful. So I have about a little bit more slices left. That's okay. We'll go ahead and fold that up a little bit like this on top. And this is going to be all nice and bubbly. And then we're going to add the breadcrumbs. Let's add the breadcrumbs on top just to give it that little crunch. You'll understand. Once it's all melted down and you dig into it, you get that nice little crunch. All right, look at that. And also give you like that cheese crust, you know, the cheese crust. There we are, okay. And then we are going to put it into the oven, 345 degrees. Let's do it a little bit slow because it's not actually real milk cheese. So we want to take it down a little bit slow. 345 for about 45 minutes. Got it? 345 for 45 minutes. And we are going to have beautiful, wonderful Southern style. Well, no, let me not say Southern style. California style, gluten-free vegan mac and cheese. Hello, hello, it's Cook's time, and today I'm making seafood mac and cheese. This seafood mac and cheese is inspired by my sister, Monty, my mother, Lady Catherine, and my stepdad, Terrence. They are advocate seafood lovers, although my stepfather decided to go vegan, but anyway. My sister and my mom both love seafood, so I decided to make a seafood mac and cheese for them, and I know they truly will enjoy this. And of course, when they come visit me, I'm going to have to make this again. Okay, so let's get started.
I add fresh garlic, salt, and olive oil to the water. Then you'll add your shellfish. And you want to cook your shellfish until you see it bright red color. We're going to cook our shellfish 1 to 3 minutes per tail. And we like to cook it all the way through to a bright red color. Make sure there's no brown. Olive oil. I'm using a cast iron skillet on high heat. Add the scallops down. We want to sear it and get a nice golden crust on each side. For our sake salmon, I'm going to cook that skin down so that the skin can get done first. Again, we're looking for a nice brown crust on it. Scallops are coming up really beautiful. Nice brown on each side. Only about, I would say, 30 seconds for each side. And flip it over. We don't want to overcook it. We just want that nice brown color. Add lemon juice for acidity. And a little bit of sprinkle of kosher salt for flavor. But we would like to keep the natural flavor. Here, shrimp. Make sure we wash it in cold water and devein both sides of your shrimp and take off the tails. We're gonna add it to olive oil. Again, fresh garlic, a little kosher salt, black pepper for taste. You want to cook it on a medium heat. Make sure we keep stirring it every 3 to 5 seconds. Cook out all the gray in shrimp. Want it nice, big, plump, and all pink. All right, our shellfish is ready to come out. Nice, beautiful red color. And you can tell when the lobsters are ready when they curl up. Here we are, we're finished with the shrimp. Let's add a little bit of the lobster stock to it. White wine. Again, it already has the garlic in it. We want to add some cold pieces of butter a little at a time. Put it on low heat. Make sure the butter melts nice and gentle into the sauce, and it'll be nice and creamy. Add lemon juice for acidity and brightness, and a little salt just to give it a little flavor. Again, keep it on low temp until all your butter melts smoothly. There we have our lobster. And our Dungeness crab. Look how beautiful that came out. Our red sake salmon. Nice golden color scallops. And our big beautiful pink shrimp.
I'm really excited about this one. Seafood mac and cheese. Okay, so I did this mac and cheese with the large elbow noodle, just like this here. So before I get started on this one, I did it with the large elbow noodle because we are going to have our shrimp scampi, our Dungeness crab leg, our wild catch salmon, and our scallop. Yes, so I want to make sure that you get a chance to see every single thing that's going to be in the mac and cheese and also get all the flavors. So we're first going to start off with heavy cream. Heavy cream for this one. So to give it a nice white cheese flavor. Look at this. Oh, it's coming together already. So put your heavy cream in it. After we do our heavy cream, we want to add our butter. Now don't worry about the butter here. It's going to melt down and distribute evenly in the hot oven. Okay, let's go ahead and add our garlic because we want that nice garlic flavor. So this is almost like an Alfredo sauce that we're making, but we're making it in the oven opposed to on top of the stove. Usually in Alfredo sauce, you will add your flour, but since I already have breadcrumbs, why not just use the breadcrumbs? And this will help thicken in the sauce. Right, and let's add some seasonings. We have to add our kosher salt because we need flavor for this because of the heavy cream. A little bit of our seasoning oil, or seasoning salt. Black pepper, again, you can add white pepper if you don't want to see the black pepper specks, but by the time you get all the seafood in, who cares? Give it a nice stir. All right, one season you are going to be surprised about, and that's nutmeg. The reason why I add nutmeg is because it's going to give it that nice nutty flavor. And it's going to go delicious on top of the heavy cream and the cheese. Just a little sprinkle, not too much. You can smell it already. Our cheeses. Cheese is very important for mac and cheese, right? Okay, so we have our Parmesan cheese, and we have our mozzarella cheese, and we have our Gouda cheese. So you can get the Gouda that's already shredded, but I like using these big nice chunks of Gouda. Guess what? Because every time you bite in there, you're gonna get this nice big burst of Gouda. Ooey gooey Gouda. And it is going to be a great surprise, and it is going to complement the seafood very well. Okay, so when you think you have enough cheese, just add some more. Lastly to it, we are going to add the egg. The reason why we're going to add the egg because we want our mac and cheese to all stick together. So for this one here, 1 egg is good. And it's going to cream up the sauce very nicely. This is going to be good. Look at this. Already it's coming out delicious. Okay, so we have our Primix pan right here, and we're just gonna go ahead and season it. We have a little bit of our vegetable oil this time because we don't want it too heavy. And again, have a nice little crunch at the bottom of it. Okay, now this is where it's going to get really nice and decorative at, because I want to make sure every single bite you get, you are going to have that nice seafood. So we're going to layer it here at the bottom. Oh my goodness. Smells so good. And then we are going to take our shrimp right over here. I'm going to chop it up a little bit, just a fine chop, because we want to make sure that every bite that you take of this mac and cheese, that you get some good shrimp. Look at this, big, beautiful shrimp, and it smells so good. Look at that.
Now I'm going to add fresh dungeon crab. Yes, I know how to crack a crab. Growing up in Louisiana, knowing how to crack a crab with your bare hands is a necessity. So I am adding about a pound of fresh Dungeness crab right into the pasta. By doing so, the crab is going to melt right into the Alfredo sauce, and with every delicious bite, you are going to get this wonderful Dungeness crab flavor. After I boil the lobster with garlic and lemon, I'm going to crack it straight down, take out the meat, chop it up, and this is about a pound of lobster. I'm going to add it right in the middle to create layers. Instead of mixing it all the way through, every time that you eat it, you'll get these wonderful, nice big bites of lobster. Wild caught sockeye salmon, my favorite. About a pound of that as well. And topped with cheese. Like I said, if you don't have enough cheese, add more cheese. A little bit of pink salt right on top for flavor. And there we have it. Seafood mac and cheese.
So I have the mac and cheese in the oven. It is going to melt down and be ooey and gooey delicious. Remember, for the seafood mac and cheese, we made an Alfredo cheese sauce. So I have these leftover lobster tails right here. I'm going to do something extra special because I know when my mom and my sister come over, and this is going to be one of their favorite meals from me, I want to make sure that I do a presentation that's going to be nice. Okay, so look, olive oil. All right, and we are going to do just like this with a clean paper towel. All right, that nice. Look at that, huh? All right, so the leftover lobster tail, look how cool this is. It's like the red color, the little fin on it. And I cracked it down the middle part so we could get the meat out. But also, if you put it like this here, and let's try to choose some really nice big ones for them. I know that they probably eat like 2 each. So let's see if we could get 4 on here. Oh, here's another big one. Okay, so this is some of the leftover mac and cheese filling that I made. I saved some before I put it all in the oven. And we're just gonna go ahead and scoop some in here, just like this. Oh my goodness, this is going to be divine. I hope they appreciate this. All right, this is going to make a great presentation. Look, just stuff it in there like that. This looks delicious already.
I'm stuffing about 1.5 cups equally for each lobster tail. Depending on the size of your lobster tail, you can stuff more. But you want to make sure you evenly distribute each amount. So that way when you cook it in the oven, it can all cook evenly, same temperature at the same time. This looks delicious. Stuffed lobster tails with mac and cheese. Oh, look at that big shrimp right there on the end. My sister Monica and my mother Catherine is going to love this. Extra cheese. Like to add extra cheese to it. That way it can help stick inside of the lobster tail. Okay, let's go ahead and finish this up. All right, that looks gorgeous. Add a little olive oil to the top and more cheese on top. Remember, if you don't have enough cheese, add more cheese. And we're gonna put it in the oven about 350 for about 12 minutes. And there we have it.
And stuffed lobster tails, seafood mac and cheese.